So, who is at risk of a subdural haematoma? Well, here are some of them. Infants in shaken baby syndrome, although this in reality only makes a minority of subdural haematomas. Alcoholics are at risk. Elderly people are at risk. There's a couple of reasons why they are at risk. Both alcoholics and elderly will have a degree of brain atrophy that is not seen in the rest of the population. This will allow more room within the skull for the brain to move around with acceleration and deceleration forces, and therefore more chance of shearing one of those bridging veins which I show you on the previous slide here. If the brain is shrunk, it will move around a lot more. Secondly, alcoholics and elderly are more likely to fall over and hit their heads anyway. Alcoholics obviously due to alcohol, and elderly due to poor mobility, poor eyesight, and those sorts of things, postural hypotension and so on. And anticoagulated patients are also at risk too. Okay, so here is a gross pathology picture, and here we can see in this coronal view, here is the dura, here is the falx cerebri, here is the dura extending over the right hemisphere, and we can obviously see this large haematoma causing significant depression and some distortion to the midline as well. I should also point out with the previous, the barn door obvious, and that these ventricles have been shifted away from the bleed. There is gross distortion of the midline. This here is the parts between the ventricles. This should be located here. So you can see this gross distortion there. And likewise in the gross specimen, again you can see distortions in the midline. Okay. So a subdural haematoma, there's different ways they can be managed. Often if it's only a small subdural haematoma, the patient can be managed conservatively, or if the patient is not fit enough for operative management, then conservative treatment may have to suffice. This is done by making sure that the patient is nursed head up, by stopping anticoagulants and by giving dexamethasone. Sometimes a burr hole can be used, or a craniotomy, as what you see here in this picture. Here you see 3 triangles of dura. This dura has been incised and reflected backwards, and here you can see the brain and these clots of blood around it. Okay, so the next one, subarachnoid hemorrhage. Now the etiology of this is quite different actually, because it's not your head injury. It's, well, at least 80% of them are due to berry aneurysms. And berry aneurysm is little saccular aneurysm between an artery, usually around the circle of Willis, and a branch. I'll show you a picture later. And these can burst and send their blood out into the subarachnoid space. If it's not a berry aneurysm, then it may be an arteriovenous malformation. Now the mean age of these is not your elderly person, as with the subdural. It's not your young man doing something violent or sporty, as with the extradural haematoma. The mean age for the subarachnoid hemorrhage is 50 years old. Now this is a serious condition, and 5 to 15% fail to reach hospital alive. The risk factors for subarachnoid include hypertension, smoking, alcohol, polycystic kidney disease, and connective tissue, CT, connective tissue diseases. They may present with complaining of a thunderclap headache. This is a severe headache, often described as the worst headache of their life, which comes on suddenly, usually instantly. In fact, so quickly that sometimes it's reported that patients look behind them to see who's hit them on the head, because the headache has come on so quickly they think someone has hit them. Signs you may find are signs of meningism, except they're not going to be pyrexic, but the blood, remember, it's in the subarachnoid space, so it's here, is going to cause irritation to the meninges. In fact, just have a little look at this. You can see the blood vessels running in the subarachnoid space. So if one of these bursts, it's going to put blood into here where the CSF is located. And there may be signs of raised intracranial pressure because blood in here where the CSF interferes with absorption of the cerebrospinal fluid. So on the CT head, you notice you haven't got a nice crescent form or a biconvex shape. You have this diffuse whitening. Remember, acute bleed is going to show in a hyper-dense pattern. So you see the whiteness here, here, over here, down here, over here, over here. Okay, this is blood which has come from a subarachnoid bleed. Gross pathology, this is what it looks here. Underneath the base of the brain you can see blood everywhere, and again underneath the arachnoid mater, the dura has been removed. You can see the extensive hemorrhage. So here is a circle of Willis which has been dissected out, and whenever you see a gross pathology specimen like that, you know that obviously the disease is serious and usually fatal, because whoever this circle of Willis belongs to is obviously now dead, unfortunately. And you can see berry aneurysms here, these little berry-like structures growing out, and notice that they come out where arteries join and branch. So this obviously ended badly for this patient. Okay, so let's look at some basic management principles of head injury.